Good evening, friends. A very happy new year, a very healthy new year to all of you, and a warm welcome to Obesity Talks, a part of Dr. KK's Med Talks. We talk today about obesity, about how to fight obesity. Let's have the obesity update first of all. Now, obesity updates us on how to fight obesity. But if we want to fight obesity, first of all, we have to understand what it is. Obesity is actually a very slippery eel to catch. Now, if you want to catch a slippery fish, you need expert fishermen. Similarly, if you want to catch obesity, if you want to take care of yourself, you want to take care of your health, then you need a very good endocrinologist. Let's see who our endocrinologist is for today. A warm welcome to Dr. Ritesh Agarwal.
Thank you, sir.
Warm welcome, Dr. Ritesh, to all of us who are gathered
Thank
here
you.
today. Dr. Ritesh is a consultant endocrinologist at Bhubaneswar, and he has extensive experience not only in clinical practice but also in academics and research. Dr. Ritesh is known across the country, across the Endocrine Society of India, for his very friendly demeanor. So, warm welcome, sir. Lots of friends here for you
Thank you,
today,
sir. Thank you for your kind words.
and also for his person-centered care. So when you're speaking with Dr. Ritesh, if you go as a patient, the patients come back saying, "बाकी जगह तो आधा ठीक होते हैं, यहाँ पे मैं पूरा ही ठीक हो गया." Just talking to Dr. Ritesh makes you feel good. So Dr. Ritesh, question coming
Yes.
from across India. We have people gathered here from across India. We have doctors, we have lay people, we have nurses, everyone. The question is, sir, what is the secret of your smile?
The secret lies in the idea of how to stay healthy, how to stay fit, and how to eat healthy. So, if you will balance all your life by work life, academic life, and your practical life, then definitely it will gives a good smile to your face.
Okay, so balance, that is the secret, right?
Yes, sir.
That's a very important thing. What is coming out is that if you are able to balance everything, then you will have a balanced smile. And I think balance is the keyword. So let's take this keyword going forward. Our topic for today is, let's see what our topic is. Obesity in us, obesity in Indians, what makes us different? So, sir, people have logged in. A warm welcome to Dr. Sapna Jain, madam. She's an advocate for healthy living with obesity. She's from CMC Vellore, a very successful business lady. Dr. Shashi Khare greets you. And so does Mr. Faraz. Now, the question is, sir, what is obesity? Our topic is obesity. How is it different in Indians? But first, let's understand what the word means. So, what does the word obesity mean? Is it part of life? Is it a disease? Is it something to be happy about or something to be sad about?
Yeah. So rightly said, sir. Now, in most of the time, though the obesity is a concern for endocrinologists for a long back, but recently it has been more come forward with the availability of the newer molecule, and it is well known by the different population also. If we see in our Indian population, the obesity, the prevalence and incidence has increased over the last 1 decade, not only in the adults but also in the youngs and children. So it is very important to define obesity, to whom you say obese, to whom you say overweight, and to whom you say normal. So for that, we South Asian population has our BMI guideline to define obesity. If it is below 18.5, we say it is underweight. If it is 18.5 to 22.9 BMI per kg per meter square, then we say it is normal. 22 3 to 24.9 is overweight, 25 to 29.9 is obese 1, then obese 2 up to 35, and obese 3 up to 40. So in this way, South Asians are defined obesity, and we are little different from our Caucasian counterpart, where the 25 is taken as a normal BMI, 24.9. So we Indians are little bit of obese before the BMI has crossed 25. So in this way, we define obesity, and any person who are coming with overweight or obesity, should need evaluation to prevent the future complication.
So Lakshmi Chandra ji also joins us, and thanks you, sir, for giving us these magic numbers. Up till 23, the BMI is normal. Up till 25, that means between 23 and 25, you are overweight, and above 25, 25 and over above 25. So even if it is 25.00, that also makes us obese in India.
Yes.
Lakshmi ji asks, sir, how do I check BMI? Can I check it at home, or do I need to go to a doctor to check my body mass index?
Yeah. Nowadays, sir, BMI is the least expensive way to check your body mass index. So, as I have said, the BMI is the kg per meter square. So, you have to measure your weight in kilogram and your height in meter square. That is in meter square. So, if you divide, you will get the BMI. Now, in the mobiles or in the apps, a lot of apps are available. You just put down your weight in kg and height in centimeter, you will get the BMI. So it is the easiest way how to measure the BMI in your day-to-day practice. So
Ramji
least
Agarwal Saab.
expensive, easily available.
So Ramji Agarwal Saab is with us. So all you need is a calculator, or you need to be able to calculate, and the formula is weight divided by height square.
Yes, sir.
So, sir, now does BMI, and our topic is obesity, is it different in South Asians? You have given us the cutoffs. 23 and 25 are the important numbers we should remember. And if you want to talk about class 2 obesity, then 30 is is the cutoff. Apart from BMI, sir, any other things that we can look at if we are evaluating uh, our physique, whether we are obese or adipose?
Yes, sir. We have different other tools are also available, out of which the least expensive is the waist circumference. Again, it is the better way. We Indians are more abdominal fatty, so waist circumference is also gives us a better idea about the metabolic health. And for that, in men, if it is more than 90 centimeter, and in female it is more than 80 centimeter, we can say it is metabolically unhealthy. We can also go for waist hip ratio and other different investigational tools like DEXA scan or MRI, which will give about the body fat mechanism, which will also gives us the metabolic health of our body. So this is the way how we can define obesity or the metabolic health of our population. So the least expensive way is the BMI, waist hip ratio, waist circumference, and you may can take a skin fold thickness also to define obesity or metabolic health.
So we have now body mass index for which we checked weight and height. And now Dr. Tej sir is telling us we can do waist circumference. Uh, One question we have from Preeti Mukherjee ji. Let's take this question, sir, and then we move on to other measures of measuring weight, other anthropometric measures.
Yes, sir.
Preeti ji कहती है, why do so many Indians, including me, Preeti ji, so we are also patriotic. Dr. Ritesh is lucky. Some people like Preeti ji and myself, we have a higher dose of patriotism around our abdomen. So her question is, why do so many Indians struggle to lose weight despite dieting and regular exercise, despite everything?
Uh, Sir, it has been studied and it has been proven that with diet and exercise, we are maximum able to reduce around 3 to 5 kg of our body weight. And it has been seen that not only we are trying, the body is also metabolically adapt ourselves. So like if we are taking less calorie and doing exercise, BMI also body metabolic adaptation will able to do all the activity with that amount of calorie. So initially we may lose 3 to 5 kg, and because of the body metabolic adaptation that is static for a period of long time. And in that regards, we need some extra push up like extra calorie restriction or extra physical activity or some outside pharmacological help that will increase the body weight loss. So we Indians are again, we our like genetically or socioculturally or environmentally, we are little bit of more different, and our food habit are more carbohydrate prone compared to our western population with less protein. So that may be a reason why we are initially losing weight, but we are not able to sustain that weight loss for a prolonged period of time.
So, Dr. Ritesh, I read somewhere, and a warm welcome to Dr. Pavan Vadhavan, who is a senior and also equally popular, just like you are, very popular diabetologist from Panipat in Haryana. Dr. Pavan is one person who leads in metabolic medicine because he practices what he preaches and he himself remains very fit. So, uh, I read somewhere that 70% of our weight is determined by genetics and 30% is determined by lifestyle. So, how do you look at this? How should Dr. Pavan, you, myself, Ruchika Vadvaji, how should we convey this to everyone? Does it mean that we should just despair? 70% of my weight is genetic, I can do nothing about it? Or is that 30% glass, is it full enough to help us change our the trajectory of our life? Not only change our lifestyle, but change the trajectory of our life.
Yeah, definitely you have rightly said, sir. 70% is genetic. But why we are treating obesity and why we are more concerned for our obesity? So if it has been seen that in overweight and obese people, we are more able to develop the metabolical abnormal diseases like diabetes, cardiovascular disease, and all these things. And it has been seen that with 5% weight loss also we are getting maximum benefit. 10% weight loss, 15% weight loss gives more beneficial effect to the insulin resistance, to the cardiovascular outcome. So this 30% weight also gives an immense benefit by losing this weight with the lifestyle and any other measure. So this 30% should be reduced to get the maximum benefit in terms of metabolic health.
And that 30% is quite a bit. Once we do that, once we actually change that 30%, then if required, then we can look at the other 70, but that 30 will be more than enough. Uh,
Yes, sir.
we have other questions. Preeti ji, thanking you, sir, for your very elaborate explanation.
Thank you, ma'am.
Ruchika Vadvaji asks, which you just answered, how is obesity different in Indians? And you said that the threshold for diagnosis is different, first of all, and then our response to medication is different, our genetics is different. We have a nice comment from the guy with stranger who says, hats off to you, sir, for working on healthcare and awareness. Uh,
Thank you, sir.
uh, रामजी अग्रवाल साहब कहते हैं, ही स्पीक्स इन हिंदी, यदि तोंद ना निकली हो तो लोग सेठ नहीं समझते. इफ यू डोंट हैव अ बेली, पीपल थिंक दैट यू आर नॉट फ्रॉम यू आर नॉट अ सेठ, दैट मीन्स यू आर नॉट अ रिच पर्सन. एंड ही ऑल्सो सेज, यदि तोंद ना निकली है तो ऐसे लगता है कि अनाज के व्यापार में उधार नहीं मिलता. सो दैट मीन्स यू डोंट हैव इनफ टू ईट एट होम, यू बोरो. Okay. So, why is this so? Is this true for Eastern India? Is it true for the entire India? Why is it that we view central obesity as a healthy thing? What happened in the past? Why is this so?
It is not like that now, sir. If you see again, the same question most of the time asked the urban population and the rural population. Now, if you see, if you think urban population are little bit richer compared to the rural population, but the obesity part is again coming similar between the two group. So it is not about the rich or the poor. It is about the type of lifestyle how we are uh, doing. Like richer people are more accessible to the processed food or the sedentary lifestyle or the uses of automobiles to go from here and there. That may be a reason. Genetic reason is there for all Indian population, but the environmental factor which is associated with the rich people, like sedentary lifestyle, automobile uses, easy accessibility to the processed food, that may be the reason why the people are having more central obesity compared to the poor population. But nowadays, poor population are also gaining central obesity as par with the richer population.
One of the reasons that occurs now, which we see, is that it is quite easy to say you should have a healthy diet, you should have high protein diet. But you see, cereal, carbohydrate is the cheapest. Sugar, wheat, rice, these are cheapest. You can get at 10, 20 rupees a kg also, you can get cereal. But if you want good quality protein, even dal will cost something like 200 rupees a kg now. Eggs, of course,
Yes,
are cheap. And if you want non-vegetarian food, that is even more expensive. Even if you are living in the coastal areas, even there fish has become expensive now. So, Dr. Pavan asks, and also we have greetings for you from Nabanita Ghoshji. Thank you, Nabanita ji, for joining us. Uh, thrifty genotype, thrifty phenotype hypothesis. Can these explain obesity in Indians? And how can we explain this to our patients, to the public, so that we can all get together on the same page to fight the disease?
yeah. So this is a pertinent question. Why we Indians or South Indian are also normal weight obesity is also more. So before that, we have to understand what the thrifty gene is. So our ancestor, mostly in history, they are having less accessible to food or malnutrition, or they are working hard. So our body metabolism is like that. We have need to store some food for ourselves, which will be utilized for the time when there is no food availability. But during this era, the food accessibility and the availability is not so hard. So it is easily available and accessible to all the population. But the thrifty gene is persist. So that might be a reason why we are seeing more number of obese and obesity. The thrifty gene is persist. We are giving more food, and the gene is storing all the food in the form of fat in the visceral organ. So that is the common cause what we are seeing in our day-to-day life.
Thank you, and we have a very beautiful message, Dr. Ritesh. This is from young doctor to be, and his or her name is Confused08. So I guess that means they are all of 18 years old right now. They are watching from Ames Rishikesh, first year student. So it's very nice, Confused08. I hope we get clarity from confusion from Dr. Ritesh today. Ames Rishikesh is a very nice place for me because I have been visiting professor there, and my son did his MBBS and MD from there. So it's good to have you on the show. So, Dr. Ritesh, now our young medical student, they are going to be a doctor. They say they are confused at first year level. Is this normal? Is it physiological?
Yes, sir. It is all 100% physiological that we all are confused during the first year MBBS student. What is about the anatomy, physiology, what things we need to know, and it is completely new things. Nowadays, the people who are preparing, they are studying biology from the beginning. But during our time, we are studying animal zoology and botany to clear the medical exam, and suddenly we go for anatomy, autopsy, and all these things. So dissection room. So definitely for first year and second year it is confusing, but they will uh, be improved with the hard work and the contribution of the teachers what they have at their surrounding.
So, our topic is obesity, how it is different in Indians. We have talked about the thresholds for body mass index. We have talked about waist circumference. Let us continue with this word called barophenotype. So, phenotype means the sum of all external attributes. So, for example, I am bald. Dr. Ritesh is handsome. Dr. Pavan is very handsome. So, these are phenotypes. Uh, Barophenotype would mean all the attributes that are related to your weight. So, we have talked of BMI. Sir, waist circumference that we talked about, what are the normal cutoffs for Indian men and women? And then, if we can go to other circumferences of the body, any other things that we can check, neck, hip, and how we can do that. And that would suddenly make anatomy a very live and happy subject for our students who are watching.
Yes, sir. So waist hip circumference is the one of the best easily accessible and non-expensive way to measure the metabolic health of our body. Especially we Indians are having more abdominal fat, which will give us an idea. So for Indian population, the cutoff for the waist hip circumference for male is around 90 centimeter. Above that is we say metabolic unhealthy, and for female it is above 80 centimeter. And again, in this way, circumference also we are different from our Caucasian counterpart, where for male it is 102 centimeter and for female it is 88 centimeter. So how to measure the waist hip circumference? You take the midpoint between the lower end of the rib and the upper part of the hip. Midway is the point from where you can measure with a measuring tape your waist circumference. Other are the waist hip ratio. So waist circumference divided by hip circumference ratio. For men again it is zero point 0.9, or for women it is zero point 0.8. If it is above, we say it is metabolically unhealthy. So these are the two non-expensive, easily available tools where we can measure the metabolic healthy or unhealthy population in our society.
Will neck circumference help, sir? So waist circumference, if you're a gentleman, then let us say you are wearing a 38-inch or a 38 size uh, trousers. That means the waist circumference is 38 inches. For neck circumference also, do we have any numbers?
Uh, I'm not aware about the neck circumference, sir.
But
Uh,
we can check neck circumference also, and we have got very good data from East India, like from Kolkata. In general, if you are wearing a 42 size shirt and you are able to tie the button and tie around it, that means your neck is 42 centimeters. Above 42 centimeters for men and above 40 centimeters for women, the chance of metabolic syndrome is higher, and also the chance of obstructive sleep apnea is also higher above 42. So, sir, we have seen now that obesity is different in Asian Indians. There is another word. This is question is coming from Swapna Jainji. Adiposity. Is there a difference between adiposity and obesity, or are they exactly the same?
Adiposity are, again, there are two types, sir: white adipose tissue and brown adipose tissue, where the white adiposity are the abnormal adiposity. In obesity, we are taking weight and the both lean body mass and the fat body mass, or the uh, adiposity and the lean body mass, both into taken into consideration while taking obesity. Like if we are taking BMI, which is a measures of obesity, where we are taking both bone mass, lean mass, and fats, subcutaneous fat, visceral fat. But adiposity is the measure of the fat percentage in a body, which can be measured by the DEXA scan or the fat measurement tool. So we can define both as a different. Some of the persons have, like we Indians is seeing the YY paradox, where we are more adipocytes, abnormal adipocyte with the normal body weight, BMI also. So we are having normal weight, metabolic unhealthy. So in that regard, we can define adiposity and obesity in a different way.
So this is also very important, sir. Thank you. So even if you have normal weight, you might be obese. So one term is normal weight obesity. Uh, Another term, like you have used, is metabolically unhealthy obesity, or metabolically unhealthy normal weight. Uh, Muno is another term, MUNO, metabolically unhealthy, non-obese. So some people can be MUNO, metabolically unhealthy, non-obese. And this is because of basically the wrong place where adiposity or adipose tissue is being deposited. Sir, one question we have, if we before we go on with the discussion, Indu Ahuja ji asks, how does stress influence weight gain and sleep? Why is it that stress is can cause weight loss also in some people and weight gain in other people?
So it has been seen that, sir, both has their own way to regulate the metabolic parameter in our body. So it is advisable always to take 6 to 8 hours of normal sleep, which will give better control, hormonal control. It has been seen that with the lesser sleep, there is a hormonal disbalance between the uh, hunger, like the ghrelin, which is increased, and there is a decrease in leptin, which is a satiety hormone. So in that way, lesser sleep will increase the hunger hormone, which is more causing the intake of food or carbohydrate or the processed food that cause weight gain. In the same way, stress, we all know stress is a condition where we are giving more cortisol hormone. So cortisol again is a hormone which is responsible for increase in synthesis of the adipocyte or fat, with increase in the insulin resistance. So both this condition, less of sleep, which will increase more hunger hormone, and stressful condition, which will increase the cortisol hormone, metabolically they are detrimental to the uh, obesity health.
There is also a term that we see now frequently on social media. One other way how we are different from the rest of the world is that we are more influenced by social media as well. This is a good thing as well as a bad thing. But sir, on social media now we hear the term cortisol belly. So cortisol belly, Cushing syndrome. Would you like to talk about this, sir? How endocrine diseases can cause different types of obesity?
Yeah. So in endocrine diseases are most commonly, as you have said, the Cushing disease or the cortisol syndrome, which can be both endogenous. If it is endogenous, we say it is Cushing syndrome, or for it is exogenous steroid intake, like most of the person who are taking steroid for some arthritis problem or some skin disorder or for some respiratory problem, they are developing this cushingoid habitus with more central obesity. So this is known as cortisol belly or the cortisol syndrome. Other though they are not metabolically so abnormal but causing weight gain are the some form of hypothyroid is giving weight gain, but that is not metabolically unhealthy because of the increase in fluid intake.
Thank you. And a very nice comment coming from Dr. Badhavan. He says, just like we use mono or metabolically unhealthy obesity, we have got TOFI, TOFI, thin outside and fatty inside.
Yes, sir.
So, yeah. Uh, Ruchika Vadva asked a very nice question, and this would take us to the next step of diagnosis. First, we were talking of anthropometry, how to measure things, which you can do on your own or with the help of a measuring tape. But and thank you, Ruchika ji, for raising this point because it brings us to the next step. Somebody has got normal weight, normal body mass index. How do we find out? What test do we do to find out whether that person has normal weight obesity? And then how do we find out whether it is harmful?
Yeah. So the best way, and again the non-expensive way, is to measure the abdominal circumference. So even if we have normal weight, as I have said, we Indians are having thin outside, fat inside. If the weight is normal, BMI is normal, but the waist circumference is more than 90 for male and more than 80 for female, we can say it is metabolically unhealthy. Second things are the skin fold thickness, which can be measured by the slide calipers, or we can go by the investigation like the body fat percentage measurement with the DEXA, or we can do the MRI also. So in the DEXA, we can calculate the subcutaneous and the visceral fat, which can gives us the idea about the metabolically unhealthy normal weight obesity.
And supposing we don't have access to DEXA, the bioimpedance machines, let us say I go to the gym and
Yes.
then they use a bioimpedance. Sir, how accurate is that? Should we rely on that? Does it help us?
Uh,
How can we use that?
Actually, the DEXA scan is the more accurate way to measure the body fat and the different type of fat. But impedance can gives us an idea about the different composition of the body fat. So we, though it is not so much accurate as per the DEXA, but we can know about the metabolic health of a person by the impedance uh, biometer.
We have got different types of bioimpedance machines. So you can have bipodal, that means two hands or 2 feet. You can have tetrapodal, that means two hands and 2 feet. That's four. You can also have uh, bipodal across the limbs, that is one hand and 1 foot. So if you have a tetrapodal machine, you can trust that more, but make sure that the machine has been validated and make sure that it undergoes regular checks as well. But still, these help. And sir, even if this is not available, you talked about BMI, uh, waist circumference, hip circumference, neck circumference. Which single one out of these will tell us about normal weight obesity? Which single circumference should we use?
I will most preferable to use the waist circumference, sir.
So
That
thank you
will
so
gives
much.
more about the metabolic.
And I guess that answers Ruchika ji's question. So, if even if you don't go to the doctor, if your waist circumference is more than 80 centimeter as a lady, more than 90 as a gentleman, then that means you may have normal weight obesity. So, do get a checkup done. Sir, one more question we have. This is from Anil Ahuja ji. Anil Ahuja ji is a leading businessman, a business magnate of New Delhi, and he lives a healthy life with obesity. But his question is, how does weight gain increase the chance of heart disease and diabetes? What does that adipose tissue? What does it do to the heart, or what does it do to the pancreas, or the target organs for insulin sensitivity?
Yeah, so it is again the completely medical term how we can define what are the complication it will causes because of the increase in visceral adipose tissue. So mostly this visceral adipose tissue causes the increase in the inflammatory markers like TNF alpha, interleukin 6, which is responsible for the insulin resistance. And this insulin resistance along with the inflammatory marker causes the endothelial dysfunction. And this is the common soil hypothesis where this endothelial dysfunction can lead to the endothelial problem of the blood vessel of the coronary artery, of the renal artery, or any other parts. So that may lead to cardiovascular disease, insulin resistance leads to diabetes and hypertension, dyslipidemia, and these are the complications you will face because of the increase in the visceral adiposity.
So this fat, let us talk about two things, are quality and quantity. So one is in obesity or adiposity, the quantity of fat is increased. Because the quantity is increased, and as it in India, in our physical build, in our phenotype, we don't have too much of a subcutaneous space for fat deposition. The moment our fat goes in excess, we end up depositing in the visceral area. And even when that becomes overburdened, when our storage space gets stretched, then we begin depositing adipose tissue in ectopic areas like the retropharynx, the around the heart, around the liver or pancreas or kidneys. So one is about quantity. What about the quality? Is the quality of adipose tissue also abnormal in people who have obesity?
Yes, sir. Previously, also I said there are brown adipose tissue and the white adipose tissue. Brown adipose tissue are the good adipose tissue, which is mostly found in the subcutaneous part. So brown adipose tissue are the indirectly to say it will more required energy to burn, and it will also helps to decrease the inflammatory marker. Normally, with the gaining weight, with the more accessible to the food and the processed food, this brown adipose tissue some way also converted to the bad visceral adipose tissue and endogenous production of this visceral adipose tissue. So both quality and the quantity of the adipose tissue are the determining factor to develop the metabolic problem. So the bad cholesterol or bad adipose tissue along with more increase in the visceral bad adipose tissue are responsible for the chronic development of the metabolic disease.
So we have got white tissue. In Hindi, the word would be safed. Then we have brown tissue, bure rang ka, and we also have an in-between one which is called beige, B-E-I-G-E. The closest Hindi word would be biscuity rang. So that reminds you of biscuits, biscuits and cookies. But you are right, both the quantity and quality become abnormal. If we move now to a solution statement, and Flora Fatherji says that we keep on talking about problems in obesity. What about action? And his specific question is, our food and our exercise, is it different from that is followed in the West? And how is the obesity epidemic shaping up in India as compared to the West?
Uh, it is true, sir. Our food is little bit of different compared to our Western population because we are more taking carbohydrate and less protein. So this carbohydrate will increase the insulin resistance again. Higher amount of carbohydrate is again stored as a fat in our body, and because of this increased insulin resistance, we are synthesizing more fat compared to our Western population. Our genetics are also different compared to the Caucasian population, as we have discussed about the thrifty phenotype. Our socio-cultural environment, different cultural activity, different festival, different family and friends, and now because of the availability of the more processed food and increase in the more screen time with others, the obesity now, the epidemic of the obesity is more increasing in our population compared to the Western population. And in the data also it has been seen in the National Family Healthcare data, around more than 100% increase in overweight and obesity has been found over the last decades compared to the earlier population.
So, and this is something that is occurring throughout the world, Flora ji. It's occurring across India, and the phenotype may vary. Our national motto is unity in diversity. So, we may look diverse, we may speak diverse languages, but when it comes to obesity, we are all united. Obesity is equally bad across the country. Uh, Tanuja Bishji, thanking you so much, saying, sir, very informative, and you have made things so simple for us. When it comes to treatment, and Tanuja ji asked about BMI, so can you answer this specific question again, sir, though you have answered it? Is body mass index alone enough to know if I am obese?
Uh, Body mass index, no, sir. As I have said, we have also normal weight, metabolically unhealthy person where the BMI is normal again. So body mass index will guide us how we can approach to a large population where we can filter the patients who are overweight and obese. Based on the body mass index along with the waist circumference, and if there is availability of the impedance meter or the DEXA, we can easily say which patients or which persons are metabolically unhealthy and who require only lifestyle modification or require pharmacological therapy or require any bariatric surgery.
Sir, we have many questions coming in for pharmacotherapy. So let's take them before we talk about lifestyle modification. Dr. Shashi Khare has a question, and also Lakshmi Chandraji has a query, as well as Dr. Pavan. So, sir, what are the drugs that are available now in India? Oral, injectable, what are the drugs that we can use for weight management? And once we begin with the answer, then more and more questions will come in.
For weight management, sir, the oral actually some of the molecule are not approved for the weight loss. They are approved for diabetes, but they are giving some form of weight loss because of the mechanism of action, like the oral GLP-1 analog, SGLT2 inhibitor, some form of metformin. They are giving weight loss, but they are not supposed to give the person who are having non-diabetic. But for non-diabetic obesities, recently two molecule which is approved is the injectable GLP-1 analog and the injectable GLP and GIP analog, which is available as tirzepatide and injectable semaglutide. And one more molecule which is earlier available is the injectable liraglutide with a higher dose, which is approved for the age group of 6 to 18 years. And the recently approved molecule are only approved for age above 18 years for non-diabetic obesity. So pharmacologically, we have diabetic with obesity where some molecules are options are available. For non-diabetic obesity, we have liraglutide 3 milligram, semaglutide at its higher strength, and tirzepatide at its higher strength.
So all of them are helpful, and you should be in touch with your endocrinologist before you start with your endocrinologist or physician. Sir, Dr. Shashi Khare has a specific question, and he says that when we use a drug like semaglutide or maybe tirzepatide, it causes weight loss. That's fine, but does it reduce only the fat mass, or does it also impact muscle mass?
Yeah. So very pertinent question again, sir. And it has been seen that any form of acute weight loss, either it is due to diet or due to exercise or due to pharmacotherapy, any form of acute weight loss will gives you both the lean muscle mass and the subcutaneous fat mass or the visceral fat mass loss. With the availability of the injectable one, it has seen that around 70 to 80% weight loss is due to the fat mass and 10 to 20% weight loss is due to the lean body mass. But the lean body mass which is lost is not so prominent, and we can be avoid this lean body mass weight loss by taking more proteinaceous diet with doing some resistant exercise during the period of taking this molecule. So it will give more beneficial effect to the lean mass and detrimental or the reducing effect to the fat mass.
So there is a risk, like Dr. Shashi has rightly pointed out, but overall the cost benefit ratio is in favor of benefit. More of uh, fat loss occurs with all these drugs, and you can prevent muscle loss by taking a high protein diet. So, any specific exercises that we can do to improve our
Mostly
muscle
the
mass?
resist Yes, sir. So mostly the resistant exercise which will improve the muscle mass, like isometric exercise where we can improve the muscle mass, or doing some resistive exercise like taking dumbbells or doing push-ups or like this. And along with that, we need some protein, high protein diet to maintain the muscle mass. So high protein diet with resistant exercise will maintain the muscle mass with the use of this group of molecule.
So resistance exercise, and you don't have to go to the gym. You can do at home also. Pick up books, uh, heavy weights, just put them up and down 10 times. Let us say you are used to only walking as an exercise. That is the most frequent or the most popular exercise in India. I go for a walk. Make sure that you walk a bit fast. You should get slight discomfort, very slight. You should not be able to talk to the person whom you are walking with. If you are conversing or gossiping with the person whom you are working with, that is not exercise. That means you have not reached the required metabolic rate. And also to convert walking, which is an aerobic exercise, into a resistance exercise. Why don't you try walking on your heels? Walk on your heels. Suddenly the muscles will change. The muscles that are being used will change. Then walk on your toes. That will change the muscle use again. And you might want to add 1 or 2 kg weight around your ankles. So the sports shops, they will give you weights, or you can make it home. You just tie weight around your leg and then walk. And with all these ways, you can convert walking also into a resistance exercise. We got this message with a message. The question is also coming again and again. And the message also from Dr. Ritesh that BMI is fine, but waist circumference along with that you would like. So that would help. And if you want the exact answer, then bioimpedance or DEXA machine. This comment is from Nabanita Ghoshji. So, sir, we have talked of drugs. We have drugs. You have mentioned both oral as well as injectable drugs. Now, suppose I go to my doctor and the doctor says, yes, it makes sense to take an injectable therapy for obesity. So, what are the things I should be aware of as a person living with obesity? I also have rights, is it not? I should know about what is happening in my body. So, what are the questions I can ask? And what kind of things do you think that endocrinologists will teach me about?
So, rightly said, sir, indirectly to know what are the normal side effects or the adverse effect what we are face in our day-to-day practice with this molecule. So, every person should know about this, and also as a endocrinologist, we will say to our patient before starting this molecule. So, mostly the GI side effect, which is the most common side effect with this molecule. So, nausea, vomiting, some of the person will have diarrhea. These are the side effects. Any of the person who have history of pancreatitis, if they are not telling to you, you have to ask them, is there any history of pancreatitis? Any of the history of thyroid cancer in future, or any of the history of dehydration, acute kidney injury? These are the group of patients where you can avoid this group of molecule. So either you can ask to your patient, or if the patient are aware about these things, they should ask you, and you have to clarify their doubts before starting this molecule. And
Sir,
you
when I start,
should not use
yeah.
this molecule in pregnancy and type 1 diabetes patient as a management of diabetes with weight loss.
So there are different ways of medication counseling. Dr. Narendra Singh has joined us. So one mnemonic that we use, one simple framework that we use for medication counseling is called BLACK, BLACK. Let us take that one by one. B for benefits, L for limitations, A for anticipated adversity, what can happen, C for cost, and K for knowledge. What is the knowledge we should have when we write? So let's go through it one by one. Sir, what are the benefits? Let us say I weigh 100 kg, my BMI is 31. What would be the benefits if I were to start injectable weight loss therapy?
Yeah. So benefit is depending on how much weight loss we are giving to the patients. Sir, it has been known that 5% body weight loss will gives us the metabolic benefit in term of reduction in the blood pressure, able to walk properly, reduction in the obstructive sleep apnea. 5 to 10% weight loss gives us a improvement in the blood sugar level, hypertension, dyslipidemia, and other metabolic parameter. And reducing more than 10 to 15% of the basal body weight will gives us benefit in terms of cardiovascular outcome, reduction in the inflammatory disease, reduction in the obstructive sleep apnea, and all these things. So amount of weight loss will determine how much benefit we are getting, and around more than 10 to 15% weight loss will definitely gives a clear metabolic beneficial outcome to us. So definitely it will gives a benefit in all its respect.
So that's a very clear-cut answer. Weight loss, even 5% will give you a lot of benefit. And if you are able to reach 15%, that would be excellent in terms of all metabolic and mechanical health. L in our mnemonic is for limitations. So, what are the limitations of weight loss therapy? We will talk about side effects later. And a specific question coming from Dr. Singh and Dr. Pawan is, will these medications replace healthy lifestyle?
Definitely not, sir. Healthy lifestyle, it has its own benefit what we are getting. So healthy lifestyle includes not only the diet, it also includes how we are maintaining for a prolonged period of time, physical activity, proper sleep, and stress management. This all includes the healthy lifestyle, which is much more beneficial. After that, if we are unable to lose the weight, we need pharmacotherapy. And the limitation of the pharmacotherapy, as I have said, we are unable to use during pregnancy, obese pregnancy, in type 1 diabetes, in hospitalized patient, and in other things. So I think, sir, any other way you can highlight the limitation?
Perfect. That is what is most important, like you have highlighted. And the medication will have its own benefits on all the cells of the body, including the heart and kidney. But when you exercise, that exercise itself will have separate beneficial effect upon the muscles and upon the blood vessels. So it will exercise separately through different mechanisms, will improve your blood pressure, your heart health, your muscle health. And we have this Odia saying, Dr. Ritesh, 1 plus 1 is equal to 11. And a question coming from Dr. Aves, how is, sir, you have spoken so much English. So he says, please translate it to Odia for us. 1 plus 1 is equal to 11. We need Odia translation, sir.
सर 1 प्लस गोटिए 11। लाइक अगर अगर मैं इसमें बोलूँ सर, जैसे लाइफस्टाइल मॉडिफिकेशन एंड फार्माकोथेरापी will gives more weight loss compared to the monotherapy alone. That is 1 plus 1 is 11. It is not 2.
And speaking in Odia parlance, taking the anti-medication therapy alone will be like eating boiled fish. You will not get the taste. But when you add little bit of spice, when you add little bit of spice even to boiled or steamed fish, then you get the exact taste. So that is what lifestyle modification will do. It will add spice to the fish, and that will be the perfect meal for us from a metabolic point of view. So we have spoken of, sir, benefits and limitations. What about anticipated adversities? Any side effects that we should be aware of, and how can we minimize them?
Yes, so most commonly, as I have said, sir, most common side effects is the GI related side effect because of its mechanism of action. So to mitigate this side effect, if we will advise the patient to take less amount of food or frequent food with less fatty food will improves the GI improve side effect. As and when required, we can give PPI to the patient to improve the nausea and vomiting part. And most commonly, avoid the oily and the fatty food. Take small portion of the food, and the frequent food will mitigate most of the GI side effect arises due to the GLP-1 analog. As and when required, we need prokinetics or PPI to improve the GI side effect.
Thank you. And then C is for cost. So, what is the rough cost like? And can you compare the costs in India with the costs in the West, maybe in US, UK, or UAE?
In Indian population, as we know, sir, it is now available at a cost of 10 to 12,000, starting at a cost of 10 to 12,000 per month to around 25,000 who are taking maximum dose of the tirzepatide or the semaglutide. So those who need this molecule, like those who have BMI of more than 27 with comorbid condition, and if they are able to afford this, then definitely this is a good molecule to start in them. And we have also seen that some of the patients who are on insulin or who are on hypertensive or dyslipidemic medication, by starting this molecule within 1 month, they require off medication or reduce the doses of the other medication, especially insulin and the hypertensive and dyslipidemic medication. So definitely, if the person is affordable, this is the molecule of choice. If cost is an issue, which is a major problem in our India, then other options are available which can be chosen as per the need of the patient and the comorbid condition the patient has.
And then the last is K for knowledge. So, black, that is benefits, limitations, anticipated adversity, cost, and knowledge. What is the knowledge that you require? So, if we are taking injectables, sir, how easy, how difficult it is to inject? Are they very complicated? Like, do I need to go and do a PhD in mechanical engineering to be able to inject? Or can I learn easily?
No, sir, it can be learned easily. And earlier also the GLP-1 analog were available like the dulaglutide or others one, which is easily available pain, and it can be taken as easily as we are taking insulin in our day-to-day life. The best part is that apart from insulin, it do not require any uh, food intervention like before or after, or you can take at any time of the day. So this is the best way how it differ, but the exact technique is the same what way we are taking our insulin, so easily taken by the person at their home, do not require any assistance to take this molecule.
So, in a very simple black and white manner, sir, you have been able to explain this to us. And thank you coming your way from Vinayak Sharma ji, Dr. Shashi Khare as well, who thanks you for delivering a great master class in obesity and making things so simple for us in such a masterly manner. One more question we have answered. Let me take it again. Ghosji asks, why is abdominal obesity more dangerous? So there are multiple reasons. First of all, the location of the abdomen. In the body, we have got two types of circulation. One is systemic circulation. The other one is portal circulation. The abdominal fat, it is so close to the liver. So when it secretes its hormones, fat will have happy hormones and harmful hormones, healthy hormones and harmful hormones both. So when it secretes its hormones, all these go directly to the liver through the portal circulation. The liver we know is the center. It is the like it is the foundation of our metabolism. So when all these harmful hormones go to the liver and they will go directly from the visceral tissue, from the abdominal fat, they have a worse impact there. Second thing is in terms of balance. So the visceral fat, that is the abdominal fat, they secrete more of pro-inflammatory hormones, which cause inflammation, which cause swelling in the body, which cause damage at each and every organ. And they secrete less of houseful hormones or happy hormones. One example is adiponectin. So you will have more pro-inflammatory cytokines coming from the abdomen as compared to subcutaneous fat. You will have less happy hormones like adiponectin coming from the abdominal fat. Because you have less adiponectin, you will have more hunger and people will eat more. Second thing is that there is more of lipolysis in the abdominal fat. So the abdominal fat cells, they begin secreting free fatty acids, or they lyse, they break down and they begin secreting free fatty acids, which are also harmful to the entire circulation and body. So the quality of the abdominal fat is different from the quality of the subcutaneous fat. Dr. Agarwal, we have discussed so much about obesity. We have learned how it is different in Indians. We have seen our cutoffs for obesity. We have also seen that we have medications available and we can use that. And you have focused on lifestyle, both diet and exercise, high protein diet and resistance exercise. Question coming from Narendra Singh ji, Swapna Jain madam is, you are a leading figure of the Endocrine Society of India and also the Endocrine Society of Odisha, the Odisha Endocrine Society. So, what are the activities that these societies are doing to fight obesity, to fight adiposity?
Mostly, sir, especially our Endocrine Society of India is doing a lot of awareness program like obesity conclave. They are giving more idea about the obesity in the social media platform, in the YouTubes. We what we are also doing is also way how we are making awareness about the obesity in the general population. In Odisha Endocrine Society, sir, we are doing camps where we are measuring the BMI and waist circumference, where we are find out what are the prevalence and incidence of obesity. We are doing camps in our schools also because it has been seen that the obesity is now more increasing in the children and younger population compared to the adult. So we are finding in more than 100% increase in risk of overweight and obesity in the younger generation compared to the older generation. And we are giving health talks at the different uh, uh, social media and the print media and in the TV media, which will awares more the people about the obesity, overweight, and their complication, so that they will maintain a healthy lifestyle and maintain a healthy work activity with the balance in the social, physiological, and uh, practical life that will help to maintain the good health.
So, sir, first the question when we started was, what is the secret of your smile? And now Narendra
Yes, sir.
Singh ji and Ramji Agarwal saying, आपको thank you, धन्यवाद कह रहे हैं for actually bringing clarity to such a confusing area. But they have a googly question for you now. What is the secret of your good health, they say? What is the secret of your leanness? That is what they are asking.
Sir, that same thing we have discussed. I, especially if I am saying about myself, I do regular yoga for 1.5 hour every day, which includes both pranayam and yoga. I will also more focus on my diet. I will take two major meals per day and three snacks, which includes fruits and mostly the sprouts. So two major meal and three small snacks per day with a 8 hour of sleep. I think I explained my health, though I don't think I am metabolically healthy because my BMI is around 26.8. So as per the Indian calculation, I am coming under obese category. So I am not metabolically healthy. I will do more, but anyone can, by this way how we have discussed, they have reduced their weight, they have improved their visceral fat, and they will lead a very good healthy lifestyle.
Thank you so much for that. It's nearly 8 p.m. now, and we'd like to thank you for the way in which you have explained such a heavyweight subject, obesity, and how it is different in Indians to us in such a simple and lightweight kind of manner. Uh, Two questions. Let me just take one. Manzoor Energy says, what are the normal values for interleukin 6, TNF alpha, leptin, adiponectin, total CRP? These are actually, Rena Saab, these are actually more used in research. And there is a lot of confusion. For example, if you want to check leptin or adiponectin, would you check in the fasting state? Would you check postprandial? If you were to check post meal, would you want to check after a meal, after a mixed meal, or after 75-gram glucose? So all these confusions are there. Once you sort these out, then another confusion is, would you want to check in the systemic circulation, that is venous blood, or in the portal circulation in the liver? So since we do not have the answers to any of these are used only in research actually, not in clinical practice. CRP is used in clinical practice as a risk stratification tool, but we have better tools available than that. Even for leptin adiponectin, I would strongly urge that as endocrinologists, as physicians, we stop looking at them in isolation. You look at ratios. So it would make much, much more sense to look at the leptin adiponectin ratio as compared to leptin alone or adiponectin alone. There's a thank you coming your way from Snehunsu Adhikari ji as well, who says thank you for your lucid explanation. And Adhikari ji says, can we discontinue the medication, sir? I started at 80 kg. Now I'm at 85. I'm happy. Should I discontinue my therapy?
Yeah. Again, sir, a lot of evidences are available for the discontinuation also. So it has been seen that after discontinuing for around after taking 1 year or 2 year, uh, there is a regain in weight. So though the regain in weight is not up to the level of baseline, but definitely yes. So the mechanism, to say in simple word, whatever you are getting out of the molecule, if you will remove the molecule, the effect will wash down. So after that, you have to give more focus on your lifestyle, diet, and exercise to maintain the weight loss what you have gained because of the medication. Otherwise, you will again regain the weight because of the metabolic adaptation and the frequent intake of the foods or the processed foods because of the socio-cultural environment what we are seeing in our day-to-day life. So I will preferably advise, because if you say 85 to 80, I definitely think as a Indian height, your BMI should be around 27 to 28. If cost is not an issue right now, I will prefer to continue the medication to reach a BMI of 23, then more focus on the lifestyle modification.
And another thank you, sir, from Punjab, from a city called Talwandi Sabu, where Dr. Sanjeev Bansal is logged in, and Dr. Bansal sends you his greetings. So from the extreme west of our country. Dr.
Thank
Rana
you, sir.
continues with the query, fasting and venous blood. So, to be honest, Dr. Rana, I would not be aware of the exact values right now, but I do know that the values for leptin and adiponectin are very heterogeneous, very high. So, like for example, if you want to check, let us say, prolactin, or you want to check even TSH or T3, the range is quite narrow. But for leptin, adiponectin, the range is huge, and it also depends upon age, gender, and adiposity per se. So obese people will have more of leptin, for example, because they have got leptin resistance. And the range is so wide, like it may vary between maybe zero point 0.2 and 20, something like that, nanogram per ml, that it doesn't make sense to do them in practice. But from a research perspective, certainly we should look at these ratios. So, Dr. Ritesh, I'd like to thank you once again. As we say in KK Med Talks, thank you, Shukriya, Dhanyavad, Meherbani, all different languages. In Haryanvi, we do not have a word for thank you, sir. So, the closest that we can say is Thara Bhala Ho, Aapka Bhala Ho. And with that, Sabka Bhala Ho
Thank you,
in
sir.
India.
Thank you, sir. Thank you.
Thank you, sir. And I personally hope that now, after listening to Dr. Agarwal, I am also energized. So I'll do a little bit more of exercise, focus more on my diet, and I'll come back to you in the next KK talk. Leaner, meaner, stronger, happier. So with this, everybody, thank you so much for being with us. Jai Hind.
Thank you, sir. Thank you, Jai Hind.